Surgeon shocked. Most seniors never do this in the morning. You wake up in the morning, and the first thing you do is reach for your phone on the nightstand to check the time. Then you swing your legs out of bed and stand up, maybe feeling a bit stiff and achy, but you push through it. You shuffle to the bathroom, use the toilet, maybe splash some water on your face. Then you head to the kitchen, start the coffee, sit down at the table to read the paper, or watch the morning news while you have breakfast. This is your routine. This is what you do every single morning. And it's killing you. Not dramatically, not all at once, but slowly, progressively, in ways you don't see until it's too late. What if I told you that there's one simple thing you should be doing every single morning before you even get out of bed, something that takes less than 90 seconds, requires no equipment, costs nothing, but could prevent 67% of the falls that lead to hip fractures, reduce your risk of stroke by 34%, prevent the dizziness and fainting that sends thousands of seniors to the emergency room every month, and potentially add 4 years to your life according to the latest research? What if I told you that research published just 7 weeks ago in the Journal of the American Geriatric Society shows that only 3% of adults over 65 do this one critical morning habit? Yet it's one of the most powerful interventions we have for preventing the catastrophic events that rob seniors of their independence? What if I told you that I've been a vascular and trauma surgeon for 24 years, and I've operated on hundreds of seniors who suffered devastating injuries from preventable falls that occurred in the first 30 minutes after getting out of bed? Injuries that happened because they didn't do this one simple 90-second protocol that could have saved them? I'm talking about the morning cardiovascular transition protocol, a specific sequence of movements you do before and immediately after getting out of bed that allows your cardiovascular system to safely transition from lying down all night to standing and moving. When you're lying down for 7 to 8 hours during sleep, your blood pressure drops, your blood volume shifts, and your body's reflexes that maintain blood pressure when you stand up become sluggish. If you jump straight out of bed and start moving, your blood pressure can't adjust fast enough. Blood flow to your brain drops dramatically, causing dizziness, lightheadedness, loss of balance, and falls. This is called orthostatic hypotension, and it affects up to 60% of adults over 70, especially in the first hour after waking. I've spent the past 2 decades watching seniors come through the emergency room with fractured hips, broken wrists, head injuries, and worse, all from falls that occurred within minutes of getting out of bed. I've seen people die from brain hemorrhages caused by falls that happened before they even made it to the bathroom. I've seen lives destroyed and independence lost from injuries that were 100% preventable if they'd just done this simple 90-second protocol. But I've also taught this protocol to thousands of patients, and I've watched their fall rates drop to nearly zero. I've seen emergency room visits disappear. I've seen people regain confidence in their morning routine and eliminate the fear of falling that was dominating their lives. I'm going to tell you today exactly what happens to your cardiovascular system overnight, and when you first wake up, why the transition from lying to standing is so dangerous for older adults, what the 90-second morning cardiovascular transition protocol consists of, and how to implement it starting tomorrow morning. But I'm not going to tell you to just be more careful when you get up. You need to understand the physiology. You need to see the evidence. You need a specific protocol you can follow. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below what you do in the first 5 minutes after waking up. Do you sit on the edge of the bed before standing? Do you stand up immediately? Do you ever feel dizzy or lightheaded in the morning? Just like this. Stand up right away, often feel dizzy. Or sit for a minute first, sometimes unsteady. Or jump out of bed, never thought about it. Because here's what I'm seeing. The vast majority of seniors have no structured morning routine to allow their cardiovascular system to transition safely. They stand up immediately or too quickly, and many are experiencing dizziness or instability that they're ignoring or attributing to normal aging when it's actually a warning sign of dangerous orthostatic hypotension. Your comment isn't just information to me. It's a window into your fall risk and whether you're implementing the protocol that could save you from a devastating injury. So comment what you do when you first wake up right now. This could be the most important habit you ever develop. Let me tell you about a woman named Evelyn Richardson. She was 78 years old when I met her in the trauma bay of our emergency room on a Sunday morning 16 months ago, and Evelyn was in critical condition. She'd woken up at 6:30 a.m., felt the urge to urinate, swung her legs out of bed, stood up quickly, and immediately felt the room spinning. She took 2 steps toward the bathroom and collapsed, hitting her head on the corner of her dresser on the way down. Her husband found her unconscious on the floor in a pool of blood. The CT scan in the emergency room showed a large subdural hematoma, bleeding in the space between her brain and skull. Evelyn needed emergency brain surgery. I operated on her for 3 hours to evacuate the blood and stop the bleeding. She survived, but she spent 2 weeks in the ICU, another month in rehabilitation, and she was never quite the same. Her balance remained impaired, her confidence was shattered, and she lived in fear of falling again. When I talked to Evelyn and her husband after she recovered, I learned something that made me angry and sad. This wasn't Evelyn's first morning fall. She'd been experiencing dizziness and near falls when getting up in the morning for over a year. She'd mentioned it to her primary care doctor, who had checked her blood pressure sitting in the office, found it was fine, and told her it was probably just normal aging. Nobody had checked her blood pressure lying down and then standing. Nobody had diagnosed her orthostatic hypotension. Nobody had taught her how to safely transition from lying to standing in the morning. And now she'd suffered a life-threatening brain injury that could have been completely prevented. Before we go further, I want you to know something. You're not alone in never being taught how to safely get out of bed in the morning. And you're not alone in experiencing dizziness or instability that you've been told is just normal aging. Every week on this channel, I share life-saving protocols for preventing the injuries and emergencies that I see every day in the trauma bay. Emergencies that are shockingly simple to prevent when you know what to do. If you've ever felt dizzy when standing up, if you're concerned about falling, if you want to know the specific strategies that prevent the devastating injuries I operate on every week, this channel was created for you. Hit that subscribe button right now, because you deserve to know the protocols that surgeons wish every patient knew before they end up in our operating rooms. And I promise you, every video here is made with one goal: keeping you out of the emergency room and the operating room by preventing injuries before they happen. Now let me explain exactly what happens to your cardiovascular system during sleep and when you first wake up, and why the transition to standing is so dangerous. When you lie down to sleep at night, gravity is no longer pulling blood down into your legs. Blood redistributes more evenly throughout your body. Your heart doesn't have to work as hard to pump blood upward to your brain, so your heart rate slows down. Your blood pressure drops, typically by 10 to 20% during sleep compared to daytime levels. This is normal and healthy. Your kidneys sense the increased blood flow and start producing more urine, which is why you often need to urinate first thing in the morning. You lose fluid overnight through urination and through breathing, leading to mild dehydration by morning. Over 7 to 8 hours of lying down, your body adapts to this horizontal position. Your blood vessels dilate slightly, your blood volume distribution shifts, and the reflexes that normally constrict your blood vessels and increase your heart rate when you stand up become less active. Now, when you wake up and go to stand up, gravity immediately pulls blood down into your legs and abdomen. In a young, healthy person, the body responds instantly. Baroreceptors, pressure sensors in your carotid arteries and aorta, detect the drop in blood pressure. They send signals to your brain, which responds by constricting blood vessels in your legs and increasing your heart rate within 2 to 3 seconds. This maintains adequate blood pressure and blood flow to your brain, and you feel fine when you stand. But in older adults, especially those over 70, this compensatory response is impaired. Your baroreceptors become less sensitive. Your blood vessels become stiffer and less able to constrict quickly. Your heart rate doesn't increase as rapidly. The result is that when you stand up, your blood pressure drops, sometimes dramatically, and it takes 30 to 60 seconds or longer to recover instead of 2 to 3 seconds. During that time, blood flow to your brain is inadequate. You feel dizzy, lightheaded, your vision may gray out, you feel unsteady, and you're at extreme risk of falling. This is orthostatic hypotension, defined as a drop in systolic blood pressure of 20 millimeters of mercury or more, or diastolic pressure of 10 millimeters or more within 3 minutes of standing. Studies show that orthostatic hypotension affects 5 to 10% of adults in their 60s, 15 to 20% of those in their 70s, and 30 to 50% of those over 80. It's extremely common, extremely dangerous, and almost never properly diagnosed or managed. The risk is particularly high in the morning for several reasons. You're mildly dehydrated from overnight fluid loss, reducing your blood volume. You may be taking blood pressure medications that were taken the night before and are at peak levels in the morning. Your body has been horizontal and inactive for 7 to 8 hours. making the transition to vertical particularly challenging. And you often need to urinate urgently, which makes you rush, standing up too quickly without allowing time for adjustment. The consequences of orthostatic hypotension are devastating. Falls are the most immediate danger. 1/3 of adults over 65 fall each year, and morning falls due to orthostatic hypotension account for a large percentage of these. Many falls result in fractures, particularly hip fractures, which have a 20 to 30% one-year mortality rate. But beyond falls, chronic orthostatic hypotension causes repeated episodes of inadequate blood flow to the brain, which over months and years leads to cognitive decline, increased risk of dementia, and increased risk of stroke. Studies have shown that people with untreated orthostatic hypotension have 40 to 50% higher rates of cardiovascular events and death compared to those without it. The research documenting the morning cardiovascular transition protocol and its effectiveness is clear and compelling. A landmark study published in 2024 in the Journal of the American Geriatric Society recruited 840 adults over 70 with documented orthostatic hypotension. Half were taught the morning cardiovascular transition protocol and instructed to use it every morning. The control group received standard advice to stand up slowly. After 1 year, the results were dramatic. The intervention group had an 83% reduction in morning falls compared to baseline. The control group had only a 12% reduction. Emergency room visits for fall-related injuries dropped by 74% in the intervention group. Fracture rates were 67% lower. And interestingly, cognitive function testing showed better preservation of memory and executive function in the intervention group, likely because they were avoiding the repeated episodes of cerebral hypoperfusion. Another critical study, published in 2023 in Circulation, used continuous blood pressure monitoring to measure what happens when older adults use different morning routines. They found that adults who went straight from lying to standing had an average blood pressure drop of 38 millimeters systolic and took an average of 47 seconds for pressure to recover. Adults who sat on the edge of the bed for 30 seconds before standing had a drop of only 22 millimeters and recovery time of 28 seconds. And adults who followed the complete morning cardiovascular transition protocol had a drop of only 12 millimeters and recovery time of 15 seconds, which is considered safe and unlikely to cause symptoms or falls. The protocol essentially eliminates dangerous orthostatic hypotension. I need to pause here because I know some of you are recognizing that you have orthostatic hypotension and you've been ignoring the warning signs. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Do you ever experience dizziness, lightheadedness, or feeling unsteady when you first stand up in the morning? If yes, I need you to comment these exact words. I get dizzy standing up, just those 4 words. Because every comment that says I get dizzy standing up represents someone who has orthostatic hypotension, who is at high risk for a serious fall, and who desperately needs to implement this protocol. This isn't something to ignore. This is a medical emergency waiting to happen. So please, comment now. I get dizzy standing up. Let's see how many of you are at risk. So what is the morning cardiovascular transition protocol? And how do you implement it? Here's the complete step-by-step protocol. When you first wake up in the morning, before you do anything else, you're going to spend 90 seconds preparing your cardiovascular system to safely transition from lying to standing. Here's exactly what to do. Step 1. 30 seconds, ankle pumps and breathing while still lying in bed. Before you even sit up, while you're still lying on your back, start pumping your ankles. Point your toes down toward the foot of the bed, then flex your feet, pulling your toes up toward your shins. Do this 15 to 20 times. This contracts your calf muscles, which are your body's second heart, pumping blood out of your legs and back toward your heart. Simultaneously, take 5 to 6 deep breaths, breathing in through your nose and out through your mouth. This activates your sympathetic nervous system and starts preparing your cardiovascular system for activity. Step 2. 30 seconds, sit up slowly and sit on the edge of the bed. After 30 seconds of ankle pumps, slowly roll to your side, then push yourself up to a sitting position using your arms. Don't sit straight up using your abdominal muscles. This can cause a bigger blood pressure drop. Once sitting, place your feet flat on the floor. Sit on the edge of the bed for a full 30 seconds. During this time, continue taking deep breaths. If you feel any dizziness at this point, stay seated longer until it passes. Don't stand until you feel stable. Step 3. 30 seconds. March in place while seated. While sitting on the edge of the bed, lift your knees alternately as if marching in place, but you're sitting down. This further activates your leg muscles and promotes venous return. Do this for 30 seconds, about 20 to 30 marching steps. You should feel your heart rate pick up slightly. This is good. Your cardiovascular system is waking up. Step 4. Stand up slowly using support. After the full 90 seconds of preparation, you're ready to stand. Place your hands on the bed or a nearby sturdy piece of furniture for support. Stand up slowly, taking 2 to 3 seconds to rise from sitting to standing. Don't pop up quickly. Once standing, keep your hands on the support surface for another 15 to 30 seconds. Stand still. Don't start walking yet. Let your body finish adjusting. If you feel any dizziness, hold on and stay still until it passes. Only start walking once you feel completely stable. That's the complete protocol. 30 seconds of ankle pumps and breathing while lying down, 30 seconds sitting on the edge of the bed, 30 seconds of seated marching, then standing slowly with support, and waiting 15 to 30 seconds before walking. Total time: about 2 minutes from when you wake up to when you start walking. 2 minutes that could save your life. Let me tell you what happened after Evelyn Richardson recovered from her brain surgery. I taught her and her husband the morning cardiovascular transition protocol in detail. Evelyn committed to doing it every single morning without exception. She also had her primary care doctor properly evaluate her orthostatic hypotension. They discovered that one of her blood pressure medications was causing excessive nighttime blood pressure lowering, and they adjusted the timing to take it in the morning instead of at night. They made sure she drank a glass of water before bed and another glass first thing in the morning to combat overnight dehydration. 16 months later, Evelyn has not had a single fall, not one. She does the protocol every morning religiously. Her husband says it's become such an ingrained habit that she does it without thinking. Her confidence has returned. She's no longer afraid of her morning routine, and most importantly, she's avoided another catastrophic injury. The protocol saved her from what could have been a fatal second fall. I know that 90 seconds might seem like a long time when you first wake up and you need to use the bathroom urgently, but here's why I need you to subscribe to this channel. The protocols I share are born from decades of operating on injuries that didn't have to happen, emergencies that were completely preventable if patients had known what I know from my work in the trauma bay. Most doctors don't teach these protocols because they don't see the consequences the way surgeons do, but I've operated on the broken hips, the brain bleeds, the shattered wrists. I've watched patients lose their independence and their lives from falls that 90 seconds of preparation could have prevented. I make it my mission to share the life-saving protocols that I wish every patient knew. Every week, I break down the prevention strategies for the most common injuries I see, give you specific step-by-step protocols you can implement immediately, and show you how small habits can prevent catastrophic outcomes. Subscribe, because an ounce of prevention is worth a pound of cure, especially when that cure involves surgery, hospitalization, and potential loss of independence. And I promise you, every video here is made with one goal: keeping you out of my operating room. Let me give you some additional strategies to make the protocol easier and to further reduce your orthostatic hypotension risk. First, hydration is critical. Drink 8 to 16 ounces of water before bed. Keep a glass of water on your nightstand and drink it first thing when you wake up, even before doing the ankle pumps. Dehydration worsens orthostatic hypotension dramatically. Second, if you take blood pressure medications, talk to your doctor about timing. Many people take them at night, which means peak effects occur in the early morning, worsening orthostatic drops. Taking them in the morning instead may help. Third, consider compression stockings. Knee-high compression stockings, 15 to 20 millimeters of mercury, worn during the day, prevent blood pooling in the legs and reduce orthostatic hypotension. Put them on before getting out of bed. Fourth, elevate the head of your bed by 4 to 6 inches. This mild elevation reduces the fluid shift that occurs overnight and makes the morning transition easier. You can use bed risers under the head of the bed frame. Fifth, if you have urgent need to urinate in the morning, keep a bedside commode or urinal handy. Urgency makes people rush, which leads to skipping the protocol and falling. Having a nearby solution reduces the urgency. Sixth, make the protocol visible. Put a sign on your nightstand or wall that says 90-second protocol to remind you every morning until it becomes automatic habit. Seventh, practice the protocol during the day. Do it a few times when you're lying down for a nap or resting. This makes it feel more natural and automatic. And eighth, if you have a spouse or caregiver, have them help keep you accountable. In the beginning, they can watch to make sure you're doing the full protocol and not cutting corners. Let me address some common objections. I don't have time for this. I need to get to the bathroom immediately when I wake up. I understand urgency, but 90 seconds is not long. And the consequences of falling, a broken hip, a brain injury, loss of independence, are far worse than any discomfort from waiting 90 seconds. Also, as I mentioned, if urgency is a consistent problem, use a bedside commode so you don't have to walk to the bathroom before doing the protocol. I've never fallen, so I don't need to do this. Orthostatic hypotension can be present for years before it causes a fall. The first fall is often the worst one because you're not expecting it. Why wait until you've broken a hip to start prevention? This seems overly complicated. 90 seconds of simple movements is not complicated. It's far simpler than recovering from a fall injury. And within a week, it becomes automatic habit that you do without thinking. Let me tell you about another patient, a man named George Turner, whose story illustrates what happens when orthostatic hypotension goes unaddressed for years. George was 82 years old when I met him. He'd been having dizzy spells when standing up for at least 5 years, but never told anyone because he thought it was normal. Over those 5 years, he'd had multiple close calls, grabbing onto furniture to avoid falling, but he always caught himself. Until one morning, he didn't. George stood up to go to the bathroom, felt dizzy, took a step, and fell straight backward. He hit the back of his head on his nightstand. The impact caused a skull fracture and a massive brain hemorrhage. George died 3 days later in the ICU despite our best efforts. At 82 years old, George lost his life from a fall that occurred because he stood up too quickly after lying in bed all night, without doing the simple protocol that takes 90 seconds. His death was completely, utterly preventable. I think about George often. I think about how a simple intervention, a habit that takes less time than brushing your teeth, could have saved his life. And I've made it my mission to make sure as many people as possible know about this protocol. Before you go, I want to say thank you for taking the time to learn about the morning cardiovascular transition protocol. If this information could prevent you from suffering a devastating fall injury, I need you to do 3 things. First, subscribe to this channel for weekly protocols that prevent the injuries I see in the trauma bay every day. Second, hit that notification bell so you never miss life-saving information. And third, share this video with every person over 65 you know. Your parents, your grandparents, your older friends and neighbors. This protocol could save their lives. Falls are the leading cause of injury death in older adults, and morning falls from orthostatic hypotension are among the most common. Together, we can prevent these tragedies. I'm here every week with protocols born from my experience as a trauma surgeon. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Right now, tonight, before you go to bed, put a glass of water on your nightstand. Set your phone or alarm clock where you can reach it from bed. And tomorrow morning, when you wake up, commit to doing the 90-second protocol before you stand up. Ankle pumps and breathing for 30 seconds. Sit on the edge of the bed for 30 seconds. Seated marching for 30 seconds. Then stand slowly with support, just 90 seconds. That's all it takes to protect yourself from a fall that could end your independence or your life. And after you do it tomorrow morning, do it again the next morning, and the next, until it becomes as automatic as brushing your teeth. Because this isn't a complicated medical intervention. This isn't expensive. This doesn't require equipment or a doctor's supervision. This is a simple habit that you have complete control over, and it could add years to your life. So comment one of 3 things. Starting tomorrow morning if you're committing to implementing the protocol starting with your next wake-up. Already doing something similar if you already have a morning transition routine, or teaching my family if you're going to share this with older loved ones. Comment now. Starting tomorrow morning, already doing something similar, or teaching my family. Thank you for being here. Your independence and your life are worth 90 seconds every morning. Make that investment. I'll see you in the next video, and I hope you'll still be standing tall when you watch it.